Forefront 5. I'm your host, Dr. Betsy Wernli, and today we have a return co-host, Dr. Gus Natalie. Hey, Gus.
Hi, everybody. I'm glad to be back.
So as you can suspect, we are talking about COVID, specifically the vaccine today. And really the goal of this podcast is to address a lot of the misinformation out there. There's a lot out there to confuse people. Wouldn't you agree, Gus?
I would.
Lots of sources of information. You know, we have the normal morning and evening news, multiple channels on your phone you're looking at night, Facebook, Instagram, YouTube. And I would say that a majority of them have a very non-medical background. So it's our hope to share with you as two doctors some real truth based on science, not fear or emotion, because that's the way we've addressed this pandemic from the beginning. And I would personally like to start the podcast by saying that you are not a bad person if you haven't been vaccinated. And I probably understand more than any other non-vaccinated response now why people are worried and might be scared of the vaccine. I looked at all the information. I've done a ton of search on medical literature. Gus and I trade different studies every morning, every night. I've talked to a lot of fellow physicians, and I did all of this before I made the decision for myself and my family back in January to become vaccinated. So my goal is to try to give everyone at Forefront and in our community the same information that helped me make what I think is a great decision for myself and my family. Gus, what do you think?
Yeah, no, I agree with you. I'm glad you brought up the concept of misinformation. I think that's been a defining feature of this entire pandemic. It's worth kind of going over those terms. So misinformation is defined as false information that's shared by people who do not intend to mislead others, whereas disinformation is false information that's deliberately created and disseminated with malicious intent. And both of those are at play during this pandemic. We've seen misinformation on vaccine development issues, safety, effectiveness. There's been a whole piece on COVID-19 denialism. It's been such a big issue that in July, the U.S. Surgeon General listed misinformation as a huge U.S. public health threat, and the WHO also sort of chimed in and agreed with that as well. So we've got an uphill battle. Right now, I think a lot of unvaccinated Americans think that getting natural infection with COVID-19 is somehow safer than getting vaccinated. And that really couldn't be farther from the truth. So I hope Betsy and I can try to tease out some of these issues and maybe flip that today.
Yeah, awesome. And great definitions. I agree that a lot of people who are giving out information don't mean it with malicious intent, and others do. So you really have to be careful out there. Let's set the table. For everyone, there's COVID that we knew about that originally came out of Wuhan, kind of the original COVID. And now we have tons of variants, right? We're now talking most commonly about the Delta variant. Let's talk a few key things about Delta, because that is COVID that we know it now. Number one, it's more infectious than the old COVID. Scientifically, we use a number called the R0. It shows really how well the virus reproduces. And the higher the R0, it means it spreads easier. And I think, Gus, correct me if I'm wrong, Delta is around 7 to 9, which is kind of the range of chickenpox, right?
Yep, I think you're right.
So we all remember before chickenpox vaccine, if you were around someone with chickenpox, it didn't matter how close you interacted, you were infected with chickenpox. So an R0 of 9 means that one person will likely infect about 9 people. So the new variant of COVID, the Delta variant, you can catch much easier. So cases are naturally rising throughout America. Let's talk about the original virus that came out of Wuhan. It had a specific structure, and then it just replicates a whole bunch, right? And in that many replications, it changes or evolves. And this Delta version is a result of those changes. The change in Delta allowed it to replicate in the upper airway, our nasal passages and oral mucosa, much easier than the original virus. So it is not only, replicating, it's more contagious. So now we have a variant that's more contagious. And now we have to talk about who's getting infected. Both vaccinated and non-vaccinated people can get infected, but you have a 4 to 8 times less chance of being infected if you have the vaccine. So that's wonderful news. But even better, if you do get an infection after getting vaccinated, you likely won't be hospitalized or die. So even with this new variant, the vaccine is protecting really well with the bad outcomes. So Gus, why don't you give your take on this new Delta variant?
Yeah. Delta's the real deal. I think it's kind of changed everything. If you talk to our hospital colleagues, they all say, they say younger, sicker, and quicker. That's what they're seeing. Delta in general is probably twice as contagious as previous variants. I think the hospitalization rate in unvaccinated people is twice as high as previous variants as well. The thing I think that makes Delta so different is that if a vaccinated person gets breakthrough symptomatic disease, they're still carrying significant amounts of virus in their nasopharynx, high levels, and that's much different than the previous variants that we saw. And with these high levels, they're able to pass infection easier to unvaccinated people and other people. So that's one difference about this variant that's making an impact. It does appear, though, in vaccinated people with breakthrough infection that the viral load is going down faster in that group than an unvaccinated group. So the time of spreading is probably lower, but there's definitely a few days there where spreading can occur.
So younger, sicker, quicker, get the vaccine. That's our first plug. Let's move on to who should get vaccinated. We know I think 50% of Americans have been vaccinated. 80% of Americans over 65 have been vaccinated, which is great. I think that number should be 100% because this is our most vulnerable population. But if you think about that, 20% of the older American population, if they get infected with Delta, it's almost a guarantee they'll be hospitalized, the non-vaccinated Americans over 65. Let's talk about the folks who are not vaccinated and maybe are in that younger group, which is a lot of our employees. They're over 18. They feel like they're healthy. We're going to leave the pediatric vaccination talk for another time because I think we have so much information for employees at forefront. My opinion, everyone over 18 should be vaccinated. I don't feel there are any exceptions. Gus, what do you think?
Yeah, I agree with you. Honestly, the contraindications of vaccine are very few. Basically, the only known contraindication is if you had anaphylaxis with the first dose, or if you have known anaphylaxis to any of the ingredients. Now, that is an important piece because the mRNA vaccines have something called polyethylene glycol, and then there are a group of people who have anaphylaxis to that compound. The J&J vaccine has something called polysorbate 80, so someone who has known anaphylaxis to that would want to stay away from that vaccine. But that is really it. I get calls all the time from my colleagues about various reasons why not to get the vaccine, but it's very simple that none of those really count. I'll get calls about somebody had hives after the first dose. Can they get their second dose? And the answer is absolutely. So it's pretty straightforward. And yes, I agree with you, Betsy. All adults need to be vaccinated.
Yeah, and let's define anaphylaxis. It's not like you felt anxious, your heart raced, you were super nervous after the vaccine. That could just be needle phobia. Anaphylaxis is true closing of the upper airways. You have to go to the emergency room, get epinephrine, or you will die. So this is a very rare reaction that happens in life in general, let alone to the vaccine. Let's talk about some reasons we've heard from concerned individuals. I actually thought it would be fun. Gus and I field multiple emails and phone calls every single day from Forefront employees, which we love. We love that you care enough to reach out to us and ask us questions. So we thought we'd take actual questions that we have received from folks concerning the vaccine. And Gus, I'm going to give my take and then I'll let you give your take. So the first question is, hey, the vaccine is man-made and I don't trust it, so I'm not going to get vaccinated. So here's Betsy Wernli's take. This virus isn't going away. We can mask all we want, vaccinate. And the more I think it will continue to persist as something we need to protect ourselves from, at least in the near future. Right now, our best bet to protect is the vaccine. So regarding the man-made concern, here's my take. Let's take a step back and ask, would you rather take the risk of a medical development, the vaccine, that was developed by really smart men and women who actually have skin in the game, right? They put this in their bodies. Doctors put this in their bodies, their children's bodies, their parents' bodies. A vaccine that, for the most part, people who spent 12 years to study the human body, pathology, and the body's response to things such as viruses are actually using in themselves. Or would you rather take the risk from a virus that came out of Wuhan, China? Either of these you can think is unpredictable. I don't think the vaccine is unpredictable, but many of our colleagues or employees do. Many people wonder about the origins, kind of this man-made concern of the vaccine. They're worried about its origin. But if you're lining these two up, I think it's non-negotiable, but every American has to take the choice. They're either going to get infected or get the vaccine. There's no gray area where you'll stay safe. Everyone will be infected. So do you want to choose the option that talented men and women developed to protect humans and they put in their own body, or something that many people believe may have been developed in a lab in China, or it came from a bat in China? That to me is way scarier than the vaccine. So that's my response to the vaccine is man-made and I don't trust it. You're going to choose one or the other. I think the vaccine choice is smarter and much safer than a virus that was developed either in bats or in a lab to kill. So that's my very blunt take. Gus, how about you?
Yeah. The vaccine is man-made, and I think that's just a testament to science. It's actually genius on how the technology works. As far as not trusting it, that for me is sort of hard for me to wrap my head around. So, the randomized controlled studies that were done had almost 80,000 people in them. I mean, a good randomized control study has maybe, 2,000 to 3,000 people. So this was, a highly powered study. And we have multiple avenues of sort of post-vaccination ways to look for serious adverse events, afterwards. And those are occurring, and, they have found a few things. But the trust is there. The science was robust. It was done well, and we have people watching moving forward. But to kind of move on to what Betsy was saying, I agree with Betsy. I think at this point, the way this pandemic's playing out, I mean, we're not going to hit herd immunity maybe ever anytime soon, but you are making the choice at this point of either getting vaccinated or getting exposed to natural infection. There's no in between. You can't choose not to get vaccinated and also not get infected. That's just not going to happen. So when you're talking about making this decision, it's really a risk-benefit analysis, of the two arms there. And I'm here to tell you sort of unequivocally that the risk, or the benefits, I should say, of vaccination sort of far outweigh the risks of getting natural infection from, SARS-CoV-2. And those studies have been done as well, and we can sort of talk about those. I think a really good example, and we'll get to the myocarditis piece here in a second, but it's been shown in a recent New England Journal of Medicine study that your risk of myocarditis from natural infection is significantly higher than from the mRNA vaccine, just as an example.
Yeah. We should have said at the beginning, it reminds me just listening to you talk, Gus. Are you paid by Pfizer, Moderna, J&J? Do you have any connections whatsoever?
No, I'm looking, I would love some, but no, I'm not. I have no connections.
Yeah, me too. We truly are just encouraging our folks to be vaccinated because we care about people, and I guess it's a flaw in ourselves and why we became doctors. So just thought we should share that. So concern number 2. This is kind of a fun one, but I thought I'd throw it out there. There's a chip or a tracker in the vaccine. Maybe the government's doing something shady. You know, it's just not true. There are no extras in this. That wouldn't even have been possible outside of Hollywood. No government in the world has created a microprocessor small enough and powerful enough to enter and travel through the vascular system. If we want to get really into this, and just remember, it'd get jammed in the heart, it'd kill the host or be cleared by the kidneys. If it's a subdermal tracker, GPS tracking systems haven't reached the macro quality yet. The processing system would grow so hot, it would burn through your skin. So, I mean, if we're getting Hollywood here, it's just not true. So no one's tracking you, right, Gus?
Yeah, just not true. And I really don't have much else to say to that one.
Yeah. So the next point, I think that this is a good one. And it's one of the reasons that I feel it's really unfortunate when this pandemic came about during a highly political time, right? So many people say this is politicized and it's just a political pressure by parties. I agree. It came out during a terrible time during an election. We had a lot going on, but this is what I'd say to that statement. Both political parties, whether you're Republican or Democrat or neither, they chose to vaccinate themselves and their family. Donald Trump and his family were vaccinated. They were part of, the push for developing and getting Americans vaccine. And so was President Joe Biden's family and himself. And he's pushed the vaccines for Americans. So I would say on the political realm, this might be the only thing that our two parties actually agree on. Gus?
Yeah, I agree with that statement. I guess you should leave your healthcare decisions up to your health professionals and politics up to your politicians. I think the political side is real. It has been a dividing issue. But, I think this is where a lot of the misinformation avenues sort of come into play. Your physician knows the data and has spent their sort of whole career making these kind of decisions about even non-vaccines, weighing risks and benefits. And, Betsy and I are here really trying to tell you that this is a safe vaccine and sort of let's leave the politics out of it.
100%. Okay, next concern. Hey, we can still get infected. Gus, we already said it on this podcast today. I think we addressed this, but anything you want to plug forward on that concern?
Yeah, there is some data. So Delta is a little different. So, with the previous variants and the original variant, the mRNA vaccines had about 95% efficacy against symptomatic disease. That's fallen to about 67% efficacy, which is still a good number for vaccines in general. And that's why this is still being used in this setting. But yes, we are seeing more breakthrough symptomatic disease in vaccinated individuals, primarily because of the Delta variant.
But you're still way ahead getting the vaccine. I think, if this virus is bad enough to infect you with the vaccination, what's it going to do without the vaccination? I think you likely will end up in the hospital or even die. So once again, it's, weighing those two options, because really those are the only two options you have. You're going to get infected or be vaccinated.
Yeah. Let me add one other thing too. So we may talk about this a little bit later, but long haul COVID is a real concern. So that's a series of symptoms that you can get after natural infection. it's still being reported in breakthrough vaccinated people, but at a much lower rate. So that's, the vaccine helps in that regard too, on preventing complications after infection.
100%. Okay, next question. Hey, this vaccine was rushed. It's still experimental, which is not the case now that it's been FDA approved, but people still think it's been rushed through. It's new. I want to wait. It was developed too quickly and safety measures were ignored. Gus?
Yeah, this data is, or this technology is probably 20 years old. So it's hard for me to sort of say that it was rushed. I will say it somehow got that feeling, and I think that's sort of stuck in the American psyche, but it's actually just not true. mRNA technology has been around. It was initially sort of invented to treat cancer, and then they pivoted to start moving into vaccines. But mRNA vaccines before this had kind of been developed, but none of them had been used in humans until this one. Keep in mind that I think we now are on our something like 3.5 billion doses that have been given. I mean, this is nowhere near experimental anymore.
Yeah. And I would say so many Americans are on medications. Just on another topic, we see patients every day and we have to enter in their med list. And it's rare to have a patient come in my office that's not on a med. And guess what? Every med that you take is man-made. Every med that you're taking to extend your lifespan or to protect you. And so I have a hard time understanding why this vaccine is any different than your metformin or your daily aspirin or the other medications, your antidepressants that you take. They're all man-made and they're safe. And now this is not an experimental emergency authorization. It's FDA approved. So get your vaccine. All right. One last question on this vein, Gus. The vaccine, talk about the others that haven't been approved. Pfizer was just approved. What about the others? What's coming down the pike for that?
You're talking about for the other vaccines for COVID, or?
Yeah.
Well, there's the Moderna vaccine, and then there's the J&J. Do you want me to talk about just sort of the risks associated with those that we found, or?
No, just talk about, do you recommend now that Pfizer is FDA approved, just getting Pfizer, or do you think, mRNA?
I see what you're saying. Okay. Yeah. This is a good time to bring up this issue. I think, when these got their emergency use authorization, I think that sort of was one of the things where the lay public doesn't really understand what that means. Getting an EUA doesn't mean it's rushed or we're trying to get it out there faster. You have to have all the solid safety and efficacy data in place to get an EUA. And when you go from EUA to full FDA approval, it has nothing to do with safety and efficacy. So they don't go back and look at the safety and efficacy data again. They do that with the EUA. So to get a full approval, it actually has to do with, they just explore how they make it in the manufacturing setting. So it's kind of, I think, if you look at it that way, I mean, the data is already done at the EUA. So no, it doesn't change my opinion on the Moderna or the J&J. The safety and efficacy have already been proven, and that's why they have their EUA.
Yeah, I think that's such an important point. The reason our vaccines were expedited doesn't mean they skipped the safety step. They skipped some of the other steps. Safety was well established. So I think that's good news for our listeners. Let's move on to the next question. This was a good question, I thought. This person had a history of autoimmune disease. They were worried about the vaccines actually causing autoimmune disease, lupus, or what have you, to flare. Or even worse, maybe even causing a new autoimmune disease to develop. We also had someone talk about HIV, multiple sclerosis, urticaria or hives. We had someone who had Guillain-Barré, in the past, or heart arrhythmias, lots of questions about medical conditions. And you might wonder why I bucketed these all into one question, because it sounds like different answers, but it's not. Because for this group of people, especially, they of all people should be vaccinated. For me, in my mind, the biggest risk factors are age, being overweight, and comorbid diseases or immunosuppression. Those are huge risk factors. And that entire bucket, from autoimmune disease to MS to HIV, puts you in this increased risk category. So you are at baseline at a huge increased risk of hospitalization or death from natural disease from COVID-19. So you of all people should be vaccinated. Gus?
Yeah, I would agree with you. These are not contraindications for the vaccine. The only ones are the anaphylaxis issue that we discussed earlier. People with comorbid conditions have higher rates of bad outcomes, and that's even more evidence to get the vaccine to reduce your risk. I've heard this issue about autoimmune diseases flaring. I've seen psoriasis patients kind of worsen afterwards. I mean, I think that is possible. And it is reported in the literature. I saw a rheumatology study where, something like 99% of the time it doesn't flare, but there are cases where autoimmune diseases will flare after COVID. But you have to take this again in a risk-benefit sort of strategy. When you weigh things, the risk of getting infected with COVID in an immunosuppressed state without vaccination on board are much higher than the latter.
Yeah, for sure. And look at it, the risk of the same outcome, Gus. We already know that you have two choices. It's either to be infected or to get the vaccine. And so an infection with COVID-19 hugely flares my psoriasis patients or my lupus patients. So, I would argue if you're going to flare from the vaccine, you likely would flare much worse or the same with a native COVID infection. So that's my take on that.
Can I comment on the part of this question was I've had Guillain-Barré.
Yeah.
What I would say to that is I would choose an mRNA vaccine. So Guillain-Barré is not overrepresented in the mRNA group. So that's the Pfizer and Moderna. But Guillain-Barré is a known risk factor that we found, afterwards with the J&J vaccine.
That's great. That's great advice. Okay. Lots of questions about the vaccine not have been, the timeline. It hasn't been run long. So I'm going to wait. I just want to make a quick note we might not have mentioned earlier, that the native virus of COVID hasn't been around long, right? We don't know what the long-term side effects of COVID infection will be. We know a lot of infections like syphilis in dermatology has huge long-term implications. Lyme disease, that's common in Wisconsin. We have long-term effects of lots of viruses. And like Gus mentioned, long haul COVID is real. And we don't even know what that's going to look like 10 years down the road, right? So for me, taking the vaccine over the natural virus wins every day of the week, because as doctors, I think you'll agree with me, Gus, nature has been slowly trying to kill us forever, right? And there's hundreds of millions of doses of vaccine been given. We have lots of information. And one thing to consider, vaccines have been in the works forever. And not in the past 200 years is there evidence of a vaccine causing long-term side effects, but there is lots of evidence of native infection of many viruses causing long-term side effects.
Yeah, no, I would agree with you. I think waiting only makes your chances of getting exposed to natural infection higher, because I really can't stress this enough. And Betsy and I aren't making this up. The way this pandemic is playing out, you don't have a choice anymore. You're either going to get infected or you're going to get vaccinated. Infection's not good. People who land in the hospital, something like 50% of them, when they're looking out 6 months later, have some sort of new diagnosis and they're seeking medical care for stuff unrelated to COVID. New onset diabetes after COVID infection has been reported. I just read today that hospitalized patients, a lot of them will have permanent kidney damage. Long haul COVID is real. And if you haven't heard of this, there's a group of people who are having symptoms that are persisting, some indefinitely at this point. I mean, these are headaches, dizziness, orthostasis, which is, dizziness with standing. This brain fog, that's one of the things that a lot of people talk about. They just don't feel like they think like they used to. They have permanent loss of smell and taste. I mean, imagine that. It's not killing you, but that's, it's a huge quality of life issue. Some of these people have shortness of breath, exercise and fatigue problems, arrhythmias like AFib and others. The list doesn't stop there. And these are sort of persistent problems that are going on because of COVID-19 infection later and lingering.
Yeah, super scary. And that's if you don't die from COVID. I mean, that's another very real risk factor. Next question. I've been struggling with infertility, or I have a family member who has struggled with infertility. I'm worried the vaccine would lower my fertility rates. So I would say that during the trials, people got pregnant and had healthy babies. Like Gus said, there were a ton of people in the trials. The difference in pregnancy outcomes were no different in the vaccinated versus the non-vaccinated study groups. And, our colleagues, our OBGYN colleagues, recommend pregnant women be vaccinated because of the increased risk of COVID complications when pregnant. Remember, you're in a state of high metabolic turnover. You're slightly immunosuppressed when you're pregnant. So you're naturally at a higher risk for complications and death in pregnancy. And then, you can also consider that 100 million people have been vaccinated and the birth rate has stayed the same. So I don't think this is an issue, Gus.
Yeah, it's really not. And there's been good data on this. Look, the fertility issue, this is a bold statement, but never has any vaccine ever been associated with fertility. And that comes straight from the CDC website. I mean, it just doesn't occur. And with all this talk, I think some studies were done trying to appease people and nothing ever showed up. I think something like, almost 5,000 people, have gotten pregnant after one of these studies. They followed up. They looked at sperm characteristics after the mRNA vaccines, and there was no changes. They looked at IVF take rates, and they were the same. The fertility issue really has, I think, been put to rest. Now, if we're talking about pregnancy too, I agree with Betsy, and this is what all the national academies agree with too, is that pregnant women should get vaccinated. Your risk of having complications to the baby and yourself with COVID during pregnancy is considerable, and that is reduced significantly. And then there's no poor outcomes with the fetus either if you get vaccination during pregnancy.
We have lots of data on it. Lots of people are getting pregnant every day in the trials and post-COVID vaccine. I do want to mention one quick thing, because a lot of people say, well, this has been reported post-vaccine, X, Y, or Z, right? So we do have a vaccine adverse event reporting system, the VAERS, right?
Yep.
And I would encourage people to realize that we do reporting systems like this for everything. And just because something shows up on the VAERS doesn't mean it was causative, right, Gus? It means that it happened. I mean, people die every day, even before COVID. People have heart attacks every day before COVID. Miscarriages happen every day before COVID. And just because it's in the VAERS doesn't mean it was caused by the vaccine. I mean, do you want to say anything about that?
No, I do want to. I'm glad you brought that up. So I think one of the questions that people get a lot is, well, the vaccine causes death. And I think if you actually look into where that misinformation is coming from, there have been 6,000 deaths reported in the VAERS system. But you have to realize the FDA, when a death is reported, they're obligated to look at the details of every single one of those. And all of them were not associated with COVID-19 infection, except for 4, which were due to the J&J vaccine causing VIT, which is vaccine-induced thrombocytopenia and thrombosis, that clotting disorder for those people who have died. So, but yes, you have to be careful. So if you see somebody say, well, thousands of people have died because of VAERS, that's not entirely true.
Yeah. And I would say those very unfortunate cases post J&J vaccine that clotted, that likely could have happened with COVID infection as well for those people, and they could have passed from natural infection. And if you're worried about it, get a Moderna or a Pfizer vaccine. That's my response.
No, yeah, correct. And keep in mind, just to put, I don't think a lot of people realize this either. The J&J vaccine is only made up about 4% of the U.S. uptake of vaccines. Most of the people who've gotten vaccines in the United States, 96% have been mRNA vaccines. So I agree with you. I mean, we know that the risk of that TTS syndrome is in females aged 30 to 49. It's about 3 cases per million, which is quite low. Your risk of anaphylaxis is about 1 per million. So, if you're worried and you're in that age group, I would encourage you to get an mRNA vaccine. It's not associated with that.
No deaths from the Moderna and Pfizer, quite frankly, even though they're in the first. Yep. And that's in all full transparency. That's what Gus and I had. I had the Moderna. What did you have, Gus?
I had the Pfizer.
Yeah. And we're still here talking to you, encouraging you. So next point, I've heard the vaccine gives you COVID. My friend who was required to get it got severe body aches, headaches, fevers, had to miss a day of work. I get really bad vaccination reactions. I bet I'll need 3 days off to recover. I don't have the PTO, so I'm not going to get the vaccine. Right now, my take on this is if you're exposed, you're worried about PTO, which we know you'll either be exposed or choose to be vaccinated. If you're exposed, you'll have to take 10 to 14 days off unpaid, and that's the best case scenario. So go get the vaccine on a Friday afternoon. I had a pretty rough night after my Moderna vaccine. I made some serious spike proteins. I had some fever and body aches. But by 6 a.m. the next day, I saw 60 patients in clinic. I worked. And the weekend for anyone concerned about this will be totally sufficient to recover if you have even a, flu-like reaction to the vaccine. Gus, why don't you talk about why your body may or may not get the fever, COVID-like symptoms, and why this isn't a COVID infection from the vaccine?
Yeah, no, I mean, these are normal immunogenic reactions. I mean, in a way, if you get a reaction like this after the vaccine, you should be happy because it appears that your immune system is reacting. Now, if you have no symptoms, that doesn't mean that it's not reacting, but I think you just have to sort of flip how you're thinking about it. These symptoms tend to be short-lived, 12 hours, maybe 24, and they pass quickly. When the original phase 3 studies were being done of the mRNA vaccines, this is the only side effect that they identified. Some of the long-term stuff like the myocarditis and the Guillain-Barré and the TTS, those were found via the VAERS system. But this sort of short-lived immunogenic reaction is all that's going to happen. And it's frankly good.
100%. I already had COVID. This is the next question. So I'm immune. There's no reason to get the shot. I don't want to be uncomfortable for a day or two. I believe you should at least get 1 dose, full vaccination recommended. The studies are showing that perhaps the immunity generated post-vaccine may be more protective. I think that's up in the air, but I think the latest study I read is, the natural immunity from a COVID infection drops by about 7%, the antibody levels per month. So it decreases. So, as a middle ground, get at least 1 dose for me. I would get for sure the full dose if I could choose, but at least get 1 dose. Gus?
Yeah, the official recommendation is to get the full series. There is data that it is mixed, but that it increases your breadth of immune response, help cover these variants better. Also the depth. I will say if you've had COVID and you get your first dose of vaccine, that is probably when you're going to get your reaction. Whereas a de novo patient, typically there's no symptoms after the first vaccine, and then sort of side effects come with the second dose, whereas vice versa if you've seen it. So you should expect that. I think in England they dose it a little differently. They give it like here in the U.S. we do it at 0 and then 3 or 4 weeks. I think in England they almost do it 6 months afterwards. And what they're seeing there is better longevity of the antibodies than we are in the U.S. And I think that just goes to Betsy's point. So even if you've had it 6 months ago, getting one more dose, preferably a full series, but getting another dose is going to help your antibody titer and immunity.
Awesome. Let's talk about the fear of blood clots and myocarditis. You've touched on this a little bit, Gus. Myocarditis has been shown to be maybe an issue in kids. I think even with kids, it's 1 in 20,000 from the vaccine. And we're not really talking about kids today. We're talking adults. The cardiac problems and blood clotting risk for adults is way higher with COVID infection than it is the vaccine. So that's the main point. If you listen to and nothing else, once again, we have 2 options. You're either going to get infected or you're going to get the vaccine. Infection, if you're worried about blood clots and myocarditis, your risk is way higher than with vaccine. Gus?
Yeah. I think you have to make the decision on what type of vaccine you want. And these are all low risk problems. And in general, and this is well described, and not to bear on this point again, but your risks of complications for COVID are extremely much higher. The risk of myocarditis, that's the only severe adverse event that's been documented with mRNA vaccines. And it typically occurs in young men. Let's see, these are men sort of, age 18 to 29. That's sort of your highest risk group. But keep in mind, if you vaccinate 1 million men in that group, you may have 20 cases of myocarditis. And keep in mind, no one's died of myocarditis from an mRNA vaccine. Those are usually mild cases and they resolve quickly. But in that same group of 18 to 29-year-olds, you'll prevent 300 hospitalizations, you'll prevent 60 ICU admissions, and 3 deaths. So you sort of have to, again, sort of weigh the pros and cons.
Yeah, I totally agree.
Yeah, and then the numbers are sort of similar with the J&J, except for the risk group there is for your middle-aged female patient with TTS. Guillain-Barré is a severe adverse event that has been reported in the J&J arm. That's usually men in their 50s or 60s. But again, it's an even lower risk than the myocarditis risk.
Yeah, so if you're worried about this, you should be worried about COVID infection. And if you really want to apply the science, Gus, I would say, younger women get the Moderna or the Pfizer, the mRNA. Men who are worried about myocarditis, 18 to mid 20s, get the J&J. Would you agree with that?
Yeah, I think that's a general statement. I've been a fan of the mRNA vaccines. I think they're very safe. And I don't know if I mentioned this earlier, that New England Journal of Medicine study, I think the risk of myocarditis in all adult groups was like the relative risk was 18, which is quite high with COVID infection, but it was 3 with the mRNA vaccine. So, you have to weigh again these numbers, and it's hard for, I think in general, it's a well-known thing with human beings. It's hard to sort of risk stratify, and our human brain sort of doesn't work that well. But these are low and frequent problems, and no one has died of myocarditis.
Yeah, and I think one of the hard things that I would encourage all of our listeners to do is shift the way they've thought about weighing risks. Because I think for a year we've thought, well, gosh, my option is vaccination, or I'm just going to be real careful and avoid infection. And then the risk ratio, if you can avoid infection, sure, it looks different. But now with Delta, that's not the case. You truly are going, if you are living and leaving your house at all, mask or not, I think you have one of two choices. It's natural infection or COVID vaccine. So any question you have, I would encourage our listeners to say, okay, what are the risks? And what does this look like with a COVID Delta infection? And what does this look like with vaccination? And I would say vaccination will win any day of the week. So I think the last question is a really good one to end on, Gus. I've waited this long and I've done really well. Why vaccinate now? And the case is Delta. It's way more infectious. It's changed the game, like Gus talked about. You will be infected or vaccinated. And I would say, as we go into Wisconsin winters or winters in any of our states, this virus does really well in indoor confined spaces. So as winter comes, I think the cases will surge if a community isn't vaccinated. Everyone's inside, they're close. That's why the warmer climates now in the summer, we're struggling a bit more. Maybe in Florida, people are inside more. It's like their winters. So I think in the Wisconsin, in the Midwest, if you're not vaccinated, you will be exposed to the Delta virus indoors as winter comes. Gus?
Yeah, I mean, why get vaccinated now? I'd probably take a broader view of this, which is, I mean, don't we want this to be over? I mean, sort of that's what Fauci says all the time. He says, if you want this pandemic to be over, get vaccinated, get your family vaccinated. I mean, that's how we're going to stop this. I mean, some degree, I'm ready to sort of go back to a reasonable semblance of life. I want to stop wearing masks. I don't want to worry about my kids in school. All the downstream problems of sort of isolation over the last year. I mean, how do you quantify sort of all of these sort of non-COVID things that have come out of it? And to me, they're sort of non-quantifiable. It's just a slew of kind of misery. And we need to get past this as a society, as humans. And the only way to do it is to get everybody vaccinated. And I think that's been the piece, is we can't all seem to agree on this one issue. And that's okay. But until we can all sort of come together and get vaccinated, I'm worried about, sort of continued problems with this virus.
Yeah. So in summary, I think this is great. Gus, always love talking COVID with you. I'm kind of ready to be done with it, to be honest. I wish we could talk about something else together. But, I would say summary for myself is, take your chances with COVID or take your chances with a vaccine. And I choose the vaccine every day of the week. If you look at any of the questions above, among the others Gus and I have fielded, vaccine is the better bet for everyone. And vaccines don't save lives. Vaccination does. So go get vaccinated. Gus?
I love it. No, I always appreciate talking with you, Betsy. Yeah.
Awesome. Well, this has been another episode of the Forefront 5. I hope, if nothing else, a few of you have, their concerns addressed. I hope a few of you trust us as physicians, and I hope many of you go and get vaccinated. Until next time, thanks again, Gus.